E-health is a delivery of healthcare services using digital information and communication technologies known as internet-based technologies, and it often uses artificial intelligence, which is the use of intelligent algorithms to perform tasks or make decisions that would otherwise require human intelligence. E-health for mental health can involve everything from text messaging, peer support and illness self-management to out-of-hours support, web-based psychoeducation and delivery of therapeutic interventions, and it's really useful alongside well-established interventions in person. Engaging with e-health can also improve medication adherence and clinical engagement with in-person psychological services, and e-health has been shown to improve symptoms of poor mental health when it's used alongside psychotherapy. And this is really important, with dropout rates from psychotherapy varying from anything from 15 to 26%. Even though automation might support improved access and adherence to healthcare, the views and experiences of users from across the mental health spectrum need to be considered in the design, development and implementation. And trust is considered to be a vital part of engaging and using e-health. And there's mixed evidence about how much people do actually trust these types of e-health services. We set out to investigate the role of trust and its intersection with paranoia in the use of e-health so that we could understand how attitudes influence e-health usage and inform more ethical and responsible AI healthcare development and reduce mistrust in these potentially beneficial systems. Our online study involved over 400 participants completing questionnaires about use of the internet, use of e-health, trust, confidence, and other attitudes towards internet-based technologies, as well as experiences of paranoia and cyber paranoia, which is specific feelings of paranoia about the internet and related technologies. And there were a subset of 22 participants who completed qualitative interviews. Our questionnaire results indicated that digital confidence was associated with frequency of technology use, frequency of e-health service use, but not mental health status. When we split our participants into controls and people experiencing serious mental illness, we found that whilst the serious mental illness group did score higher on trait paranoia and symptoms of mental ill health, which we would expect, there was only a very, very small difference between groups on scores of cyber paranoia, and there was no difference in cyber fear. Our qualitative found that accessibility, ease of use, and reduced waiting times and anonymity were positive facilitators of using e-health, particularly for mental health problems, but also felt like sometimes they had to use these systems due to a lack of alternative or an obligation. In line with our quantitative findings, there wasn't a clear link between people's attitudes towards these systems and their actual use of e-health and related digital technologies. We termed this a paranoia paradox, where people did not trust or actively mistrusted e-health but used the systems anyway.
We had comments like,
I want to say that trust is really important. I know sometimes I'm a bit lax with it, so it can't be that important. I don't trust it, but I have to get to do what I want to do. I don't entirely trust anything on the internet, but I tend to go along with an awful lot. In relation to healthcare, the implications are clear that we need to improve the trustworthiness of e-health systems to ensure patients are using them in a way that will maximise individual engagement and the overall effectiveness of the technology.
It is also up to people developing this technology to do so responsibly and transparently, especially in relation to AI and data privacy. It's also up to prescribers to know about these aspects of e-health that might concern the individuals that they're supporting and provide appropriate knowledge and resources.